Hi, I'm Kevin Cummings. At Investors Bank, we believe in helping our local neighborhoods and improving the lives of all we serve. We're a different bank that makes a difference for our employees, clients, and communities. That's why we're proud to support public television and the programming produced by the Caucus Educational Corporation.
Funding for this edition of Life and Living with Joanna Gagis has been provided by Investors Bank, NJIT, New Jersey Institute of Technology, Johnson & Johnson, Horizon Blue Cross Blue Shield of New Jersey, the New Jersey State Nurses Association, and the Institute for Nurses, the Healthcare Foundation of New Jersey, founded by the Jewish community, and by NJM, auto insurance, homeowners insurance, and more, with a focus on safety and financial stability. Promotional support provided by New Jersey Family Magazine and NJFamily.com, and by bestofnj.com, covering all New Jersey has to offer.
Welcome to a special edition of Life and Living. I'm Joanna Gagis. I'm here at Giant Stadium for the third annual Health and Fitness Expo put on by the New York Giants, NBC4 New York, and Hackensack University Medical Center. All day, visitors who come to this free event can meet New York Giant players. They can play fun games right here on the field. They can get free medical screenings, but most importantly, they can put together a game plan for their own health. All that next on Life and Living. I'm joined right now by Bob Garrett, President and CEO of Hackensack University Health Network. We're here at the third annual Health Expo put on by NBC4 New York, the Giants, and Hackensack University Medical Center. Talk about this year's event and what the goal is.
Well, you know, this year's event is really about bringing the entire family in and really in a fun kind of way teaching people about being healthy, about being fit. Part of our mission at Hackensack is about what we call population health.
What is that? Describe what that means.
It means that our mission is not just about taking care of sick people, it's also about keeping communities healthy and well through education, through screening, and through fun events like this where you can bring the whole family in a fun way. They can really learn a lot, but they can also have a great time together.
You're the leader of one of the largest health networks in the state, and yet your focus is keeping people out of the hospital. Why?
Yeah, it's interesting. Sometimes I think we have a control kind of schizophrenia in healthcare today, but it truly, a health system today is really focused on both aspects, about keeping people healthy and also doing the best that we can in terms of providing the highest quality care when they are sick. Our mission really is twofold, and I think as a healthcare system, we have a real responsibility to the communities to keep people healthy. We're part of the American healthcare system, and unfortunately there's not been enough emphasis on prevention and on wellness in the past, and we believe we have a responsibility, a civic responsibility, and a corporate responsibility to do that.
So Bob, tell me what's new at this year's walk.
What's new this year is that we're featuring a new program called Tackle Kids Cancer, which is really to raise awareness and to raise money for childhood cancers. And this is really, the money's going toward research, and it's also going toward the programs that we run at Hackensack University Medical Center. We're really glad to partner with the New York Giants. Eli Manning has been the spokesperson, and he's really raised a lot of awareness for childhood cancers. And I have to tell you, there's so much hope with the research that's going on. I just attended a conference just a couple weeks ago at the Vatican. It was sponsored by the Vatican, and it had to do with stem cell research and cellular therapies. And we are really, literally on the verge of a cure for so many cancers. So Tackle Kids Cancer is such an important program, and we're featuring it this year to really spread awareness.
And tell us about the Arthritis Walk, which is a new addition this year.
Yeah, the Arthritis Walk is great. It's a new addition. There's several hundred walkers that just walked around Metlife Stadium.
Led by Victor Cruz and Steve Weatherford, right? New York Giants?
Victor Cruz and Steve Weatherford, yep. It'd be hard to keep up with them, but I think we did pretty well. And Dr. Yuki Kimura, who heads up our, she's the chief of rheumatology, pediatric rheumatology at Hackensack. She also led the walk, and she's a national honoree for the Arthritis Foundation. She's really well known in her field, so I applaud her for her efforts, because unfortunately childhood arthritis and arthritic conditions are growing, so we want to spread awareness to that as well.
And beyond that, just lots of fun today for the family.
It is incredible amount of fun. I was thinking maybe you and I could do the zip line together, talking about fun.
Let's do it. Let's do it, Bob. We'll see you on the zip line. Bob Garrett, CEO, thank you so much.
Thank you so much.
I have my eggs and broccoli in the morning. I eat a cup of oatmeal. I eat fish. You know, I do all that stuff.
I'm so pleased to be joined right now by Phil Simms, retired quarterback for the New York Giants. We are here at Giant Stadium today for the Health and Fitness Expo put on by NBC4 New York, the New York Giants, and Hackensack University Medical Center. Now, you're the spokesman for the Game Plan for Health. Talk about that initiative and why you're involved in it.
We don't have time to go through the whole thing, but the game plan is, I'll just put it in my terms, to do what you have to do to make sure you're leading a healthy life with how you eat and exercise and sleep. Of course, we all know that. But I think as you get older, and don't wait till you're older like I did. Go to the doctor, do the checkups, let them do the stress tests, you know, the colonoscopy, all these things that we don't want to do in life, do it. Because if you don't want to be somewhere down the line and go, wow, if I'd have just went to the doctors. Don't be afraid of going and worrying about what they're going to tell you. What they tell you is only going to help you and give you a chance to prevent if something's there.
You know, you said that you waited until you were older, but you had a career that kept you fit, that kept you healthy. How do you talk to guys who may be starting from scratch but a little bit older to say, look, you got to implement these lifestyle changes, eating right, exercising. How do you get them going?
Well, I think it gets more important as we get older. There's no question about it. And you know, football players, we get beat up. And sometimes you don't feel it the first few years when you're out of the game. But as life goes on, I think we all know all the little things that happened to you as a kid, they come back. And those pains start coming around or whatever it is. And, you know, I meet people all the time. What's wrong with you? You didn't play sports. Oh, I have a bad knee. I fell and when I was 20 and he's 45 now and it's bothering him. Well, you got to be preventative. In other words, take care of that the whole time. Make sure you're exercising and doing things to make sure that problem you had when you were younger, it won't become a bigger problem as you get older. So to me, it's fun. It's another way to compete, trying to beat age and beat time and stay healthy. I mean, I really, it's what I love doing it. I wake up every day going, okay, here we go. It's a battle and it's a fun battle.
Everything's a competition for you, isn't it?
Well, I can't go in the sun.
So, I'm sorry, we have you in the sun right now.
I'll be out, so I got a little sunscreen on, so I won't be out here long. But I don't play golf anymore. I don't play tennis. I don't play basketball. So I need some competition besides ping pong and pool. So eating right and trying to lead a better life has really become my great competition.
Tell us quickly what you do. What is your daily routine like? What is your weekly routine, especially during the football season when you're commentating and you're traveling a lot?
Well, that's tough. You know, I think the biggest thing during the season is my focus on eating first and foremost. You know how it is going through the airports. Every place you go by, you go, ooh, that smells good, looks good.
You got carbs everywhere. You got sugar, soft drinks.
All terrible for you. So I've learned not to get anything in airports at all, or hardly nothing, unless I'm in a layover for whatever. But I just try to watch what I eat. I try to get as much sleep as possible. Exercise does cut down quite a bit for me during the season. During the off season, I'm 5 days a week. During the season, probably 3. And so I try to make up for it by trying to eat as good as I can or as well as I can. But what happens to you, me, and everybody, when you get tired, you go, well, I'm tired, I need to feel better. That's when you start to cheat. So that's the hard thing, but I make it usually just where I'm surviving when the season's over, and then I try to correct it during the off season.
Give yourself a little slack when you need to. Quickly, you noticed some spots on your skin. Talk about what happened 7 years ago and why you are so concerned about the sun right now.
Well, men like me, my skin coloring or whatever, all men, you know, it doesn't matter what ethnicity you are, that you can have problems with your skin if you're out in the sun a lot. So.
And women too, to be fair.
And women, sure, I'm sorry, because that's why I went. My daughter said, you know, Dad, you got some brown spots. Yeah, I said, you know, I've been wanting to check them up. And I did and found out that problems were coming, and big problems. And so for 7 years, I've stayed out of the sun. No kidding, this interview right here is the longest I've been in the sun in probably 7 years. No, I'm not, no, it's okay.
We apologize for putting your health at risk. The whole point of this event is to keep us healthy, right? But I got to ask you before I let you out of here.
Go ahead.
What is the feeling like winning a Super Bowl? Describe it for those of us who will never know, never experience it ourselves.
Well, it's everything that you dream of. You know, you have dreams in your life, what you want to do and what it would be like to be in a situation where you see something on TV. So the experience, the feeling, it lived up to everything that I hoped that it would be. I remember standing in the tunnel before the game started, and they were getting ready to announce the New York Giants, and I just said, man, can I stand here for about 10 minutes? Because this is the greatest feeling that you could have. Like, of course, I understand marrying my wife and my kids, but as an athlete, and just to tell people, it was a great feeling that day.
Phil, thank you so much.
Thank you.
What brought you here to the Health and Fitness Expo today?
Well, health and fitness is a very, very good cause. It's important. My wife had told us about it. We're huge Giants fans as well, and we thought it would just be a lot of fun.
What did you do today that was really fun?
We got autographs.
From who?
Sean OHara, Phil Simms were very, very nice to us, and we had a great time meeting them.
Have you ever been here at Giant Stadium on the 50-yard line before?
I have not.
How cool was that?
It was cool.
In terms of what you learned today, there's a lot of information being given out. Anything that stood out for you?
Just that it's very, very important to keep up health and fitness in your daily regimen. No matter what age you are, kids, adults, keep it healthy. Watch what you eat, exercise, and I think you'll be in good shape.
You got an autograph today. Can you show it to me? Turn that shoulder around. Look at that right there. Phil Simms, Sean OHara. It doesn't get any better than that.
To watch more Life and Living with Joanna Gagis, find us online and follow us on social media.
I'm here with Dr. John Lacurdo, who is the Associate Director of the Trauma, Surgical Critical Care, and Injury Prevention Section, as well as Meliam Gonzalez, who's a nurse and Trauma Prevention Coordinator and Clinical Educator at Hackensack University Medical Center. We're here today at this Health Expo talking about what, Doctor?
We're talking about bike safety.
Why is that an important concern here at an event like this?
Well, the greatest threat to our youth today is trauma. It's the greatest killer under the age of 44, and if you're under 19, there's approximately 9 million hospital ER admissions with 12,000 deaths of kids every year. 250,000 of the ER visits are secondary to bike accidents.
Is it true that only 44% of kids under the age of 14 are wearing helmets?
That's it, only 44%, and 80% are preventable if they wear their helmet.
So 80% of the injuries are preventable if they had worn the helmet. Why is this, Mel? Why is this a passion of yours?
Keeping our community safe is the number one priority that has provided me the opportunity to help children before they become injured in the hospital. My background's in pediatric nursing, and time again, I saw many children that were injured that could have been prevented if they only wore their helmet or wore the helmet properly, or even the car seat properly, or just simply wearing a seatbelt.
So many preventable injuries. How aware are parents of the need, of the risk involved in not wearing a helmet?
They don't realize that they're the role models. A lot of adults get out on bicycles, they don't wear their own helmet. I'll tell you just a fast story, which is very interesting. Teaneck police a couple of years ago stopped a kid that didn't have a helmet on. They confiscated the bicycle, they brought it home. The parents were very proactive. They grounded the child, stopped him from riding, made him wear his helmet. A couple of weeks later, he was in a car accident. He cracked the windshield with his helmet. He's alive.
It's got to be stories like that that keep you going. When you're here at the event today, you're giving out bike helmets, right? When should a child start wearing a helmet, and how should it fit?
As soon as a child starts to engage in any wheeled sports activities, they need to put that helmet on. Even if they're on that little tricycle at age 3, they should have that helmet on, because it's a learning process. It becomes second nature for them just to wear that helmet automatically throughout their lifetime. And also wearing their seatbelt. In regards to wearing their seatbelt, if they first start in the infant seat, goes to a toddler seat, and then goes to a booster seat, they automatically know that they have to be buckled up. We're providing 100 helmets each day for the Health Expo, and we're making sure they're fitted. And we're also providing information for each child and each parent to how the helmet should be properly placed. There are 3 rules. It should be 1 or 2 fingers above the eyebrow. The strap should fit like a V around the ear, and it should fit snugly around their face. So we usually have them yawn to make sure that their helmet fits them properly.
Can we talk quickly about driver safety? Because I know it's not what you're doing here today, but it's another initiative that you're really committed to.
Yes, driver safety is very important. A large percent of the injuries and death and disabilities we have due to car accidents, and the greatest number of those are kids under the age of like 20 to 25, especially when they start driving. They're the highest incidents.
So how are you educating the public about not just driver safety, not just bike safety, but the importance of kids being careful and parents setting the example?
We go out throughout the community and do the education, the high schools, community events. Anytime they would like us to come, we're there.
I'm here right now with Karen Lease, who is the Vice President of Development for the Community Food Bank of New Jersey. We're here at the Health and Fitness Expo, and Community Food Bank of New Jersey has a table. Why are we talking about hunger at a health expo?
Well, hunger is really a health issue. I mean, 1 million people in the state of New Jersey are hungry every day. And when they don't have access to quality food, they get inexpensive and unhealthy food in order to cope. So that can cause diabetes, it can cause high blood pressure, and a lot of other issues.
Who is hungry in New Jersey? Talk about the statistics.
1 million people every day don't have enough to eat. That's 12% of New Jersey's population. 340,000 children. Senior citizens are 12% of the population we serve each day. So the face is every age, every stage, every generation.
What does hunger look like? Is it still a very thin, emaciated person, or can it be somebody who's obese?
No, it can absolutely be obese, because when you are hungry and trying to cope and eating inexpensive, unhealthy food, oftentimes you are eating a lot of that lack of quality product, and it is causing you to look heavier. So it is not just a thin, tiny person that has a hunger issue in this state. It's every person in every neighborhood across the state.
Let's talk about the time of year. Going into the summer months, why is that a really hard time for kids in New Jersey?
This is a very, very crucial time. When school gets out, the 340,000 children that participate in free breakfast and lunch programs through the schools are in desperate need for us to fill that gap for them. And we work closely with 1,000 partner agencies all across the state to make that possible. But donations are required. This Community Food Bank of New Jersey takes $1 and leverages it into $10 worth of product that we can provide to our partner agencies to feed the children.
So are you saying that people should not be donating food? The canned goods are great and they're well-intentioned, but the Community Food Bank can actually take your monetary contribution and triple it, quadruple it, 10 times out of $1, you said?
Yes, definitely. I mean, food is very important. We love food drives. We love volunteerism. We have 40,000 volunteers that help every day, but there's nothing like going on our website and donating $10. We can take that $10 and turn it into 100 meals. So our leverage buying power is 10 to 1 for every dollar that's given to our cause.
And let's tell people what the website is.
It's cfbnj.org, communityfoodbanknewjersey.org.
Spread the good word today. Thank you, Karen.
Thank you so much.
This is Barbara Kuzminski. She's here at the Health and Fitness Expo with the New Jersey Sharing Network. You're telling your story today. Tell us why you're here with the New Jersey Sharing Network, how you were connected with them.
My grandson was 20 months old, Jonathon Paul Kuzminski. He passed away on May 13, 2011, and through Jonathon, the lives of 2 children were saved. We got to meet his liver recipient that same year, and today he's 7 years old in full remission due to the gift of life. And how I got involved with NJ Sharing Network, not only through meeting him, but reading the stats in the state of New Jersey. New Jersey ranks 43 out of all 50 states. And my county of Hudson County was last on the list of all of New Jersey. So I knew we had a problem with registered organ donors in the state of New Jersey. So we decided to volunteer our family and do events such as this. And through our work, we've moved Hudson County up by 3 positions, and our hope is to move New Jersey up further because we do have 5,000 residents on the wait list. So the gift of life is truly important. And I have a picture of Jonathon, and on the back of it was when we met his liver recipient, Wyatt, who's in full remission today. So he's going to be 7 years old. The sunflower seed packs that NJ Sharing made up is very significant of what organ donation does, because out of one seed comes many flowers. So out of one person, you can save up to 8 lives through organ donation.
Barbara, I can't imagine what you and your family went through. But talk about what it means to you to be a part of this organization and to be sharing the word and spreading the word in the way that you are, the education that you're involved in, taking something that was so tragic and turning it into something beautiful?
Well, for one, a lot of people, years ago there were so many myths about organ donation, about how they don't fight to save your life because they're so interested in getting that organ for the other person, and actually it's the opposite. So my main goal is to get the word out that it's even more important for the doctors, the EMTs, to work harder to save your life so that in the case of something happening, those organs would be viable to be used. I've met so many people, even here. I've met recipients, a heart recipient, who thanked me. So, at the 5Ks, they see that I wear a donor family pin, and strangers come up and thank me. And that's why I do it, because we're here to save lives, and that's my main goal, is to make sure that everyone knows Jonathon's name, his smile, his face, and his gift of life to 2 children.
And of course, he was a Giants fan. We're here with the Giants Stadium today.
Absolutely.
Thank you, Barbara. I'm joined right now by Dr. Yukiko Kimura, who is the Chief of Pediatric Rheumatology at the Joseph M. Sanzari Children's Hospital at Hackensack University Medical Center. We're here because this morning there was a walk for arthritis. Talk about what you do and who you treat.
So being a pediatric rheumatologist, I take care of kids who have arthritis and other rheumatic diseases like lupus, for example. I'm here really because when I tell people that I'm a pediatric rheumatologist, they're shocked. They say, I didn't know kids could get that. I'm almost 95% of the time that's what people say. And the truth is that actually more than 300,000 children in the United States alone suffer from arthritis and other rheumatic diseases. So it actually is one of the most common chronic diseases in childhood, and is even more common than diabetes is in children. So we need to get the word out there. And we also need to work on improving the life and outcomes of people with arthritis everywhere.
Let's talk about how it presents in children. What are the signs and symptoms? What do they experience?
Well, for children it could be very varied, but joint pain is a very common symptom.
So they'll complain that their elbow hurts, their knee hurts.
They might if they're old enough to be able to explain that. So in younger kids, they may just start limping or not being able to walk, or start crawling because they can't walk, and they will have pain and cry, and it'll be difficult to figure out why.
What are the treatments that are available, and how do the treatments impact the child?
We actually have so many new treatments. It's just been unbelievable, almost miraculous, the change in terms of the number of treatments and how effective they are in the last 10 years. So it's totally affected the outcomes of kids and people everywhere with arthritis. People used to be a lot of people in wheelchairs or disabled, and children especially were crippled. And you hardly ever see that anymore. If you go to an arthritis camp, which we have one in New Jersey, during the summer, you would hardly be able to tell there was anything wrong with any of the kids. So tremendous impact. But we can still do more. We still need better treatments. Treatments that don't hurt as much as they do, treatments that are safer, and more targeted treatments. So more and more research is needed, which is part of why I'm here walking for the Arthritis Foundation.
Let's talk about that and talk about the walk and who turned out today.
The walk was tremendous. This was the first inaugural Walk to Cure Arthritis at Metlife Stadium. So there was a lot of excitement. We had giant players here, at least a couple thousand walkers, the biggest walk ever in New Jersey. And we raised a lot of money. We're continuing to raise money. So we're really, really excited. And we teamed up with the Giants and with NBC and with the Health and Fitness Expo. So there's a lot going on. Everybody's having a great time.
And I see you could not get away from the walk without getting a signature from VC. That's Victor Cruz himself. I see you got that signature on your back. Pretty exciting having them here supporting you, right?
Yes, absolutely. I'm a huge Victor Cruz fan, so very glad to see him here and supporting a great cause.
Thank you so much, Doctor. What brought you guys out here today?
Well, actually, it was my husband's birthday this week, and we're an avid Giants fan, so I said, let's go out and have some fun as a family. And so they didn't even know what we were doing today. We just said, get dressed and let's go, so we could just come out and learn more about health and also be part of the Giant experience.
You ever been on the 50-yard line before?
This is my first time.
How cool is that?
It was very exciting.
So you came here just to have some fun, be a part of the event, but did you learn something along the way? What did you find out today?
Yes, I learned a lot. It was interesting when we went to Quest Diagnostics, and I actually had my body mass index, and I had did a few exercises. We both did that to see what my physical age was, as far as how healthy I was. So
It was really good, right?
yes, it was great. A little bit more flexibility, and we also got some herbs. We also learned about massages and also just eating healthy.
There you go. What'd you do today that was really fun?
Today I went on the football field and I got to kick the ball and catch the ball.
I mean, how cool is that? You're a Giants fan, you're here at Giant Stadium, and you get to play football right there.
Yeah, it's fun.
Life and Living has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and NJTV. Funding for this edition of Life and Living with Joanna Gagis has been provided by Investors Bank, NJIT, Johnson & Johnson, Horizon Blue Cross Blue Shield of New Jersey, the New Jersey State Nurses Association, and the Institute for Nurses, the Healthcare Foundation of New Jersey, and by NJM. Life and Living with Joanna Gagis has been produced in partnership with St. Joseph's Healthcare System.